Will I have visible scars after a nose job? I'm Dr. Angela Sturm. I'm a facial plastic surgeon in Houston, Texas, and I specialize in noses. After a rhinoplasty, you usually do not have noticeable scars. What some people find interesting is that if you have an incision on the outside, it is a teeny tiny little incision at the bottom of this middle part here that we call the columella. It's at a weird angle, and so most people don't see you from that angle, so it's easy to hide. And then also where that is, there's very little tension on that skin, so it tends to heal really, really well. In the beginning, there will be little tiny sutures there. We take those out at day 5. And then after that, it can be a little bit pink. And this depends on the person. Some people are really not pink at all from the beginning. And then other people, it may take a couple of months for that pinkness sort of to fade. My skin tone, I tend to turn more red. And so I would be someone that would be pink for a little bit longer, but it's just going to fade with time like any other scar or incision. I do most of my rhinoplasties open, so they do have that little incision, but like I said, they heal super well. Used to do things like dermabrasion, microneedling, things like that, and we have those available, but knock on wood, it's been years since we've had to do anything to that incision because it just really heals extremely well. You can also do a closed rhinoplasty where you have no external incisions and everything's done inside the nose. Some surgeons really prefer this. I reserve that for people that are having only functional surgery. So every surgeon is different, but if you have that, then there's no external incisions at all. But even with the open approach, it's very minimal. It heals really well, and some people are kind of amazed to see that with that tiny incision, we can see all the way up to the top and all over the nose. So we can do a lot through a teeny tiny little incision that is at a weird angle so nobody really sees it. It's very undetectable. Is rhinoplasty painful? Most people say rhinoplasty is not as uncomfortable as what they thought it was going to be. We do give you pain medication, and we use a modified ERAS protocol, if you've done some research into this, on ways to help reduce the pain meds that we give you. And so we use some other pain meds that aren't opioids to help reduce that pain as well. But most people say they take those pain meds for maybe 1 to 3 days. It feels more like pressure, like a sinus kind of a pressure. It feels more like discomfort, soreness, rather than intense pain or like a sharp pain. The inside of the nose can feel a little stingy, almost like I had a patient describe it like when you go into a cold environment and you have that little initial sting of cold air that goes through. It's similar to that when you first come out of surgery, but by a few hours after the surgery, the inside of your nose doesn't feel like anything. So it's really not as painful as what people may think or may be concerned about, and we do give you some pain meds to help with some of that soreness. So if you have any other questions or want to set up a consult, you can go to www.drangelasturm.com or find us on the socials at Dr. Angela Sturm.